Hi, I'm Antonio Mora. Is there anything in this country that we can all agree on? Is there anything other than not liking Congress or cockroaches that even 80% of us can see eye to eye on? For months after 9/11, more than 90% of Americans supported the war in Afghanistan and the effort to capture Osama bin Laden. But we have become so polarized in the 2 decades since that we can't get on the same page as to what basic facts are, even when the data is clear or we have video proof. The national split is painfully evident in the COVID-19 crisis, where we can't seem to get much more than half the country to acknowledge reality. For example, a Gallup poll found 41% of Americans think the coronavirus situation is getting better, 39% said it's getting worse, and the other 20% thought it's staying the same. Here are the facts. The number of confirmed new cases peaked on April 3rd and have been on a gradual downward trend ever since. Even new deaths, a lagging indicator, have been falling in the U.S. for more than a week, with one day as an exception. They've been dropping around the world as well for even longer. Hospitalizations have plunged, especially in New York, where they've dropped off a cliff from 1632 on March 30th to 26 on April 21st. So any fair reading of what's happening across the country shows the situation is getting better, even if half of you don't seem to agree. Moving on, I'm not holding my breath, but you'd think that by now Americans could agree that COVID-19, in today's world where we have no vaccine for it, is much worse than the flu. Nope. A Gallup poll from earlier this month found that a substantial majority of Republicans thought the coronavirus is less deadly or as deadly as the flu. Democrats and independents disagreed. The truth is that the death rate in every country around the world and every state in the U.S. has been much higher than that of the flu. That's true even when we factor in what are believed to be a large number of asymptomatic cases. Take New York as an example. A random study found almost 14% of residents may have been infected with the virus, although only a fraction of them were confirmed cases. Even then, the death rate would still be about 0.7%. That's 7 times worse than the flu. If that doesn't convince you, just look at the absolute numbers. Despite unprecedented social distancing, COVID-19 will take more U.S. lives in a matter of months than the flu has in any recent year. When in the past century has the flu killed 50,000 Americans in 2 months? Also making COVID-19 worse is the scientific consensus that the hospitalization rate is far higher than that of the flu. Another example, what about how President Trump is handling the crisis? Again, nothing seems to matter other than our personal politics. According to a poll of polls by 538.com, a majority of Americans, 50.4%, disapprove of how Trump is handling the coronavirus crisis, and 45.9% approve. That almost exactly matches Trump's 46.1% general job approval in the Real Clear Politics average of polls, further proving the seemingly irreparable split among Americans. Finally, what about reopening the economy? One side focuses on how reopening will take lives, the other on how the shutdown will do the same. The side that supports tight measures staying in place doesn't give nearly enough weight to the health consequences of the economic devastation and the wholesale disappearance of businesses and the livelihoods they sustain. The side that wants a quick reopening minimizes the economic disaster that an out-of-control virus would cause. The split here is less severe, but no less contentious. An NBC News Wall Street Journal poll found 58% of respondents were more concerned about reopening, while 32% are more worried about the economy. If you're still getting paid or live in a blue state, you are more likely to want to keep the shutdown in place with tough social distancing measures. If you don't have a job, you own a business, or live in a red state, you are more likely to want the economy opened now. Sadly, that's where we are, caring more about our own individual situations and political preferences than what's good for the country as a whole. As some have asked, do you really think we would have shut down the national economy the way we have if most of the deaths had been in Wyoming, Kansas, and Nebraska instead of New York, New Jersey, and Connecticut? I want to be a glass half full kind of guy. I really hope that we might find more common ground, that a center in American political discourse could emerge from this crisis. Instead, I worry, as John Harris wrote in Politico, what if the next several years are marked by a distorted, dishonest, told-you-so debate over the pandemic? What if instead of launching a new season of public interest, a weak economy leaves little money or political will to solve long-deferred problems? What if this cataclysm makes us even more selfish and short-term in our thinking? Sure, we have seen some hopeful signs. Despite intense debate, Congress has almost unanimously passed stimulus bills. Trump and governors of opposing parties have occasionally praised each other and worked together. In daily life, the American people have mostly ignored their disagreements and supported each other, often heroically. One optimist, New York University sociologist Eric Kleinenberg, predicts that in the long run, it could help us rediscover the better version of ourselves. Let's hope. For now, we should set aside our political differences, follow the science and the balanced approach of the White House guidelines, and reopen the economy rationally. Vulnerable Americans, which in the interest of full disclosure include me, will need to be especially careful. As we move forward, we must also understand that what's good for the goose in this case may not be good for the gander. What's right for New York may not be for Oklahoma. What's right for New York City may not be even for Ithaca, New York. We should be able to at least agree on that.